Thank you so much for joining us today. My name is Jade Woodard and I'm the Executive Director of Illuminate Colorado, a statewide nonprofit focused on strengthening families, organizations, and communities to prevent child maltreatment. Every year we honor individuals and organizations that have contributed to our collective mission to strengthen families. Today we're honoring Dr. Courtney Everson with the Innovative Leadership Award. The Innovative Leadership Award is presented to an individual or organization who has made significant contributions to the field of child maltreatment prevention. I'm so thankful to be here with you today and to get to talk about what brought you into this work. Can we just start by telling me a little bit about yourself and what brought you to be doing this work?
Absolutely. First and foremost, thank you for this opportunity. Thank you for this honor. I think that when I really think about the history I've had to get here, a lot of my work has brought me to this place and to this conversation today. I'm an applied medical anthropologist by training, and I often say that my work exists at the intersection of public health, prevention sciences, and social policy, really understanding how can we build evidence towards something that is greater than the parts alone. How can we think about using research and evaluation to really uplift health and well-being for families, to think about moving from a focus of ill-being to true well-being, to think about moving from intervention to prevention, to think about moving from disparity to equity. And so all of the work I have done over the last almost 2 decades now, leading up to this point, has really centered on that mission, that intersection of work. And today I work with the Colorado Evaluation and Action Lab at University of Denver, where we really focus on what it means to meet partners at all levels of government, at communities, with families, and ask, what are your decision-making goals? What are the priorities for your community? What does your family need to thrive? And then we match our research and our evaluation work to exactly that. And my role really within that sphere and the work that I'm concentrated on today is all about maternal and infant health. It's about child well-being, positive youth development, and family strengthening. And so it's a great fit to be talking to you today about how that type of work and how a focus on evidence building can contribute to Illuminate's mission.
So how did you find yourself in this space of strengthening families and child maltreatment and all those other wonderful topics you just mentioned?
Yeah. So I will give both a kind of anecdotal story and then a how did my career land there. So anecdotally, really early on in my early pieces of my career, still in my graduate studies actually, I was serving as a birth and postpartum doula and was outreach and referral coordinator for a local birth and wellness collective out of Oregon. And at that time, I started to see this intersection of practice, policy, and data in a way that I had never seen before by sitting truly at the bedside of pregnant and parenting teens that were having babies and having an opportunity to really envision what their lives might look like forward. But the narrative surrounding them was, you're too young, you can't do it, your family's not going to be, the right family fit for this child, you should consider fill in the blank, whatever that looks like. And I sat at that bedside and said, what if we change the narrative from you are an at-risk teen to you are an at-promise teen? And the minute we changed that narrative together, we moved from what I like to call developing the birth plan to developing the life plan. And it was really in that kind of practice sphere of sitting at that bedside, seeing that opportunity, that I realized this is where I want to put my passion. And my skill set happens to be in research and evaluation. I'm a big fan of saying, bring your passion together with your skill set and make a difference. And that's really what kind of focused me in on family strengthening is I think we can talk about multi-generational approaches. I think we can talk about breaking these cycles of poverty, about thinking about what does a thriving infant look like? What does a thriving parent look like? If we're really willing to listen and then match, in my case, our data, our research, our evaluation to that work and right size towards it. And it was really kind of those moments of sitting there at the threshold of birth and early infancy that led me to say this is going to be where I focus my career on from a kind of subject matter perspective.
We get to work together in a lot of different ways. What are you most excited about that you're working on right now?
I think there are 2 projects with a common theme that is coming up for me. So the first is naturally the Colorado Partnership for Thriving Families. I don't think there is a day that goes by where I do not elevate that work And for those, that aren't familiar, you of course are, but that work for me really resonates because it is meant to be a cross-system initiative that says no one system, no one program alone is going to move the needle on these outcomes we're talking about, on healthy families. But together we can. And I think the partnership is having that conversation in a new way that we haven't seen done before. And I love the challenge. From a data and research perspective, I love the challenge of saying, okay, I cannot build myself a randomized control trial. I'm not going to randomize some families to getting no cross-system support and some families to getting that. That makes no sense. This isn't a program that we're building evidence on. This is a way of being. This is a systems transformation moment. And so I like the challenge, and that makes me excited to be thinking about. That means I have to think about data differently. It means I have to think about what outcomes we look at. I have to think about what experiences we look at. And then I have to ask, to what end in a different way? To what end are we collecting this data? To what end are we going to apply it? How are we going to activate it for strategic decision making, for change, for investment? So that's definitely one, because I love the cross-system piece. And I love how much we're doing that in genuine partnership. I think that my tongue twister every day is partners in the partnership, and yet it's exactly the right sentiment that we need to be working with for this work.
Yeah.
And the other project that kind of parallels that is working around perinatal substance use disorders and thinking through what does a cross-system approach to that look like. And this is one of my favorite projects because it's also my true passion area of we're back to that infancy moment. We're back to what it looks like to say, however corny it sounds, I one time saw a bumper sticker that said, peace on earth begins with birth. And ever since then, I believe that. I believe that if we really want to talk about moving upstream, we do that in our approach, we do that in our strategy, and we do that in the way that we center that family at a pivotal moment of their lives. That's pregnancy, that's that postpartum period. And so this particular project really brings in that behavioral health focus, that focus on infancy, and that cross-system work to say, how do we start to meet families where they're at, not where we want them to be? And then how do we match our research and our evaluation so we can get at data-informed action that moves the needle on that for families? So I'd say those are the two that come to mind, and they really share that focus, I think, on family well-being, on cross-system approaches, and really on moving the narrative from one that is punitive to one that is supportive and genuine.
So when I work with you, you kind of feel like a unicorn to me because you have this beautiful mix of research and data and passion and ability to really translate that into the work that we do. One of the things that I have heard you speak about really passionately is equity. Mm-hmm. Can you speak to how the work that you do as a researcher and evaluator is helping to improve equity?
Yeah, absolutely. It's such a great question, and one that we should really always start, end with, and infuse in the middle. And I think that from a data and research perspective, one of the things we have traditionally seen is actually the ways in which research has, at best missed the mark on moving the outcomes because we didn't pay attention to this piece, and or at worst, advanced outcomes for some and left others behind. Mm-hmm. And I think I have a real responsibility as a researcher to be thinking about what does it look like to use data for liberation on community levels, for true justice, for equity in those outcomes and experiences, and not just maintaining the status quo. One of my favorite things to think about is I could either inform your work as a researcher or I could help transform it. Mm-hmm. And if we're going to get to that transformative piece, we're going to have to think about equity. And so some of the ways we do that, and the way I really approached it, is through, first and foremost, a community-engaged framework, thinking about partnerships, we're back to that, thinking about what are priorities to families, to communities, but also recognizing that the outcomes that are important to the systems are not always the outcomes that are important to families. And part of equity is asking, what's important to you? How do I measure that to show the needle, or show if we're moving the needle on that particular piece? To be thinking about also outcomes for whom and under what conditions. If I just look at the whole sample, I may be like, oh look, we made a statistically significant difference. Researchers love to say that. But then if we start to drill down, we say only for this segment of our community. Mm-hmm. And so part of equity is finding out, what are the drivers of change for whom, and under what conditions. And then really starting to say, all right, here's the data that shows if you invest in X policy, you'll start to move the needle on these outcomes for this population. And for this investment in this strategy, you'll move it for this population. And I think using data to right-size our approaches to get at that piece of equity, to get at that piece of access and justice is a responsibility, and it's your honor to be able to do and to contribute to.
So what's on the horizon that you're looking forward to?
I think that when we really think about what does the future of our prevention work look like, we are so well positioned in Colorado because we genuinely believe in innovation. Sometimes people say they believe in innovation and they don't put the resources and the investments and the decision making behind it to truly let that come to life. And we have bold leadership in Colorado, we have bold thinking in Colorado, and so I'm really looking forward to thinking about how we can continue this cross-systems conversation and think about cross-systems data. What does it look like to bring together our data across systems to inform that policy level? When we inform that policy level, when we work with our partners at all levels of government, when we really work with our communities and families as a whole, that's when we're able to think through what's next on the horizon, because that's when we're going to start saying, all right, the data show X, let's right-size our investment to really get at that greater good, right? Not just talking about the absence of the bad, but the presence of the good. I think that's what's next. And I think if we can start using data to really inform that conversation so that we're not just putting resources 10 days late, $10 short, but start to leverage opportunities thanks to our data that are coming up to connect that cross-system. That's what's next on the horizon for me, to really think that through across all of our different sectors, our partners, and to really ask the question, what is the next priority for Colorado? How do we build evidence around that priority in a way that's meaningful, in a way that gets to that greater piece?
I just feel so grateful and so blessed to get to work with you every day and to get to learn from you and to get to have you as a part of this work. And you truly are a leader, and you are transforming our work for sure. Thank you for being here today. Thank you for everything that you've done with us, and I look forward to what's still to come.
Thank you so much.